Good evening, everyone, and thank you for joining us for this patient-focused webinar. My name is Taylor Kendricks with InsiTech, and I'm delighted to be a part of today's virtual educational event. We're going to take a few moments to allow everyone to log in, so thank you for your patience as we wait for attendees to join. The presentation will begin shortly. And we'll get started in just a few moments as we allow everyone time to log in. Thank you for your patience. All right, it looks like we have a great group of attendees with us, so let's get started. The goal of today's webinar is to provide valuable educational insights. We are honored to have Dr. Jonathan Butler from Riverside Neurology Specialists here with us today. Dr. Butler will be discussing focused ultrasound as a treatment option for individuals diagnosed with essential tremor or Parkinson's disease. Throughout the presentation, if you have any questions, please use the Q&A button at the bottom of your screen. We'll address as many questions as possible during the Q&A session after the presentation. Now, let me take a moment to introduce our esteemed speaker, Dr. Jonathan Butler. Dr. Butler is a fellowship-trained and board-certified neurologist with subspecialty training in movement disorders. With his expertise in movement disorders, Parkinson's disease, essential tremor, and spastic conditions, Dr. Butler specializes in deep brain stimulation selection and management, MRI-focused ultrasound selection, as well as advanced device interventions and botulinum toxin injections. A firm believer that diseases do not occur in isolation, Dr. Butler addresses the multifaceted characteristics of patients and their families, and he is also careful to pay attention to symptoms that may either be treatment side effects or more subtle disease effects. Dr. Butler earned his MD PhD from the Medical University of South Carolina. He completed an internal medicine internship, adult neurology residency, and fellowship training in movement disorders at Vanderbilt University Medical Center in Nashville. Board certified by the American Board of Psychiatry and Neurology, Dr. Butler has substantial research and teaching experience. Originally from San Diego, Dr. Butler is married with 2 children. They appreciate the multitude of activities in Hampton Roads and proximity to extended family. Dr. Butler's hobbies include boating, cycling, and international travel. Welcome, Dr. Butler, and thank you for taking the time to share your expertise with us this evening. The floor is yours.
Thank you, Taylor. Thank you, everyone, for joining us this evening for a talk about focused ultrasound mainly and its application in treating essential tremors as well as Parkinson's disease tremor. So get started. So what we're going to talk about today is mainly some facts about essential tremor, what it is, who it affects, and some characteristics of it. We're going to talk about focused ultrasound and what it is, how it was developed, and how it's utilized to treat some tremoring symptoms in various conditions. Who is a good candidate for treatment, as well as some clinical results from various studies that have been performed showing results and effectiveness. What a potential treatment day would look like, as well as what's insurance coverage for the procedure. Also treating the second side for people that have tremors on both sides of the hand, what that looks like and what the success with that is, as well as we have a few videos to show of patients that have experienced this procedure as well as their results. So what are some facts about essential tremor? So essential tremor is also known as familial tremor, goes by the name of idiopathic or potentially benign tremor. Essential tremor just means that it's a tremor alone that's not caused by any other medical condition or any other secondary cause. About 50% of the cases that are out there tend to run in families, which means hereditary or that familial component. So, such as a brother or sister or a parent may have had it. But about 50% or half of the patients don't have a relative with it. It can progress very slowly, usually over years to decades, but it can get to the point where daily activities are quite challenging and require assistance. About 10 million Americans are affected with essential tremor. It's the most common most common movement disorder condition that we encounter, actually. People often live with it without ever getting treatment because they may not know there's treatment, or they're just reluctant to see a provider about it. Um, about 50% of people that do get treatment, though, with either medications or some other procedures, may not have good results with just medication alone, or they may get side effects to medication. So we're going to talk about some other options that are potentially available, such as the focused ultrasound. This is just showing the amount of population that's affected by it. So in about 7.5 million patients in the U.S., and as far as the tremor or Parkinson's population, about 1 million people affected. People that are actually diagnosed with the condition, quite a bit less than actually have it. So about 1.5 million for essential tremor, 800,000 for Parkinson's. People that are treated with medications, but it's just not effective enough. Again, about half of those. And then of that population, who's a candidate for an advanced treatment, such as focused ultrasound or deep brain stimulation. Of the people that actually get that, looking at the numbers at the bottom, only about 1,500 treated with deep brain stimulation or 2,000 with a focused ultrasound treatment. So what that's really saying is that almost 97% of the people that have this condition are undertreated or untreated. So there's quite a few individuals that are good candidates for this. What is the treatment approach for essential tremor? So after diagnosis, typically medications may be used. So we use some blood pressure medications called beta blockers. Propranolol is the most common one that gets used. Issues with that is it could potentially lower the blood pressure too far, or sometimes people get excessively tired with it. Anti-seizure medications are also used. Primidone is one of the more common ones. Alternatively, topiramate is also used. They can also have their own potential side effects, such as tiredness or other cognitive effects. Sometimes anti-anxiety medications are used as well. If you can calm down some of the stress that drives a tremor, that a lot of times will improve symptoms. But again, they have their own potential problems. There are also some wearable devices that exist out there. They're external stimulator devices that provide some feedback. They can sometimes reduce tremor symptoms, but usually the results are not that great. Sometimes just putting some weight on it, such as a weighted glove, that's another wearable device that can be employed for some individuals. People that are much more disabled by it, or just don't tolerate some of these other treatments, may elect for a procedural intervention, such as focused ultrasound, which we'll discuss a bit more about. Sometimes injections with things like Botox can be tried. Deep brain stimulation is a neurosurgical approach that's also utilized to treat tremor in essential tremor, as well as Parkinson's disease. And some of the older treatments that were available for procedures, such as a radiofrequency thalamotomy or a stereotactic radiosurgery. So doing some of the similar things we do with ultrasound, but with older technologies. So what's the deal, or what's the fuss about focused ultrasound? So what is focused ultrasound? So how did it come about? What is it? How does it work? Who's a good candidate for a treatment? And we're going to show you some results. We're going to address each of these points. So how did it come about? So there's about 20 years of development of a MRI guided focused ultrasound. The company that provides most of the commercial devices now is Insightec. They were founded over 25 years ago. The first treatment from an intact skull was done about 2005. It was actually approved by the FDA for single-sided treatment for essential tremor in 2016. So it's been almost 10 years since it's been approved for single-sided. Medicare covered it a couple years later. And then that same year, they also approved treatment for Parkinson's disease tremor, targeting the same location that is used for essential tremor. A few years after that, it was approved for another target in Parkinson's disease. And then more recently, it's been approved for a second side, so treating both sides of the brain. They are done differently, or they are done at different times, but you can come back and have the second side treated. This year, actually, an additional target was approved for Parkinson's disease to address some other symptoms, but it's still working through insurance coverage. As you can see, there's a little bit of a delay. So there's new targets coming online all the time. This is the device itself. So we have a MRI machine. This is the ultrasound device, and this is an MRI bed. I'll just play a little video here to give an overview of it. So the device itself fits onto the MRI bed. Patient head goes into the device itself and then goes into the MRI. The reason we use it in MRI is you can get a very high resolution picture of the brain to be able to target where the ultrasound energy gets delivered. The ultrasound energy is delivered from a whole number of different stimulator devices outside of the brain, and they all come together at one point. So we'll talk a little bit more about that. So how does it actually work? So sound waves from the ultrasound are directed through that device, which is kind of a helmet-shaped device, through the skull and can focus down into an area called the thalamus, which is a deep structure in the brain. Where all of those ultrasound beams come together causes the tissue itself to heat up. And by doing that, we can make a small lesion in the brain that interrupts some of the tremoring circuitry. This is, and most folks, they have improvement right after the treatment is performed. This is a spiral drawing of someone before treatment and then right after treatment. So who's a good suitable candidate for it? Well, someone that has a diagnosis of essential tremor that's not responding well to medications, or people have had side effects, or people with tremor in Parkinson's disease that's not adequately controlled by their medication treatment alone. There is an age requirement, so just being over 22 years of age for essential tremor and 30 years of age for Parkinson's disease. People can tolerate being in an MRI machine, typically without some sedation because you need to participate in the procedure itself. Able to communicate with the providers doing the procedure in order to be able to either stop the machine or stop the procedure as it's going on if untoward side effects are happening. What's a potential contraindication for it? If you have a problem where you can't get an MRI, such as an implantable stimulator device, or if there's metal in the body where an MRI can't be performed, that's something that unfortunately can't be done. One of the screening tests done before the procedure is having a CT scan of the skull to make sure that the density is not too much. If it is, then the ultrasound energy cannot get through the skull itself to provide adequate heating. So that is a screening test that's done. This is some data showing the procedures that were done in subsequent years going back to 2016, some worldwide procedures. So each subsequent year, more and more procedures have been performed. And we don't have 2025 data on there yet, but over 20,000 procedures have been performed with fairly good results. The rest, this is some clinical results based off of some data even as the approval was coming through in a variety of different journals. There's multiple societies supporting the use of this, neurology, neurosurgery. So first side, which is treating just one side of the brain, some 5-year clinical results. So having had the procedure done and then 5 years afterwards, about 73% improvement of the tremor at a 5-year follow-up. Most people have very good improvement after the procedure itself, but there may be some slight reemergence, but at least 70% maintain 70% benefit at least 5 years on average. So what's the data telling us? There's really no adverse events were recorded. There's no new adverse events happening after the treatment itself. And then activities of daily living and quality of life had significant improvement. About half of patients had functional disability. They remained improved at 5 years afterwards. Some of the potential side effects, a little bit of balance issues, some gait problems, about a quarter of the patients, some numbness and tingling in about a third of the patients, potentially some headache or some head pain right afterwards. Of all these adverse effects, about half had resolved by 30 days. At 5 year mark, the adverse events were relatively moderate to mild. No new adverse events were reported. And the most common remaining adverse events was tingling, so numbness and tingling, about 20% of patients. So what does a treatment day look like? So the day of the procedure, patient comes in, the hair does have to be cut, the head has to be shaved, so the device itself can fit over the scalp, so the ultrasound energy can get through. Some local numbing medication is used, and then a frame is put on the head to keep it from moving while the procedure is done. Patient goes into the MRI machine, and the MRI is performed to get targeting data, so the right location can be selected. After that, some ultrasound energy is delivered, and this is some of the novelty of an ultrasound procedure, is that there can be some sublesional energy delivered, which allows you to see, are you getting the proper reduction in tremor and not getting side effects that you don't want. That's done to find exactly the right spot. Adjustments are made if need be. And then once the right spot is found, that's when a higher level of the ultrasound energy can be delivered to heat up that small area in the brain and get control of the tremor. So what to expect? So immediate and usually durable tremor improvement. Again, 73% of people maintain good tremor control in 5 years. Significant improvement in quality of life. Patients go home the same day. This procedure is done as an outpatient. You come in, you get it done, you go home the same day. Little to no risk for infection, as there is no cutting, there's no surgical involvement. There's nothing implanted in the brain. It's done with an MRI, which is a magnet, and ultrasound energy, which is sound waves. So there's no ionizing radiation. There's no anesthesia that's used, and relatively minimal complication risk. I do have a video from one of our Riverside patients. So I will play that. This is on our website to see, but.
Diagnosed with Crohn's disease and struggling with your symptoms,
Apologize for
it's
YouTube.
soon to talk to your doctor about.
What we did today was we used a new treatment with focused ultrasound to non-invasively treat my patient who had Parkinson's disease. The procedural technique involves placing a frame around the person's head.
So the frame I was talking about to keep your head from moving.
And that attaches to the person's head with some pins after local anesthetic given. And then that serves as a point of reference and also to hold the head and the brain very perfectly still during the procedure. And the rest of the procedure is conducted in the MRI scanner, and we use a specialized piece of equipment that focuses ultrasonic waves at a particular spot that we choose within the brain. And the anticipation is that we would see at least 60, but up to 90% reduction of the tremor. So we do a lot of testing with the patient. We want to see their tremor, and then we want to make sure we're correctly targeting the area of the brain that's involved. And we can do a couple of test treatments without causing any other permanent side effects. And once we see that we're getting the desired effects with the tremor being reduced, and that we're not seeing any unwanted side effects, then we can go ahead and give what I would call a full dose of energy with the ultrasound waves to that particular area of the brain. Anytime we see such an obvious, visible change in the person's neurological function and such a life-changing improvement. I just think that's emotional. So to be able to do something like that that's really safe, and we see, the immediate effects without really any substantial recovery, I think that is kind of amazing. Let's go back and do the left.
See that his right hand was treated during this procedure.
Actually, I didn't experience anything negative, no severe pain, nothing. I tell you what, 100% like it should have. Advice is to seek out the closest institution that provides this care. And if it's Riverside, you shouldn't have a problem. Dr. Salvin to this guy. I would recommend anybody to have it done, and I'm going to have the left side done as soon as I can.
Patients now are becoming very savvy. They're self-educating. They like the idea of the immediate effects, maybe being able to avoid having something implanted and avoiding a trip to the operating room and the expected recovery from an operation.
So discuss a little bit about insurance coverage for the procedure. It has full coverage with Medicare, Cigna, Anthem, Aetna, and Blue Cross Blue Shield. Blue Cross Blue Shield, almost every state for first side essential tremor. Second side coverage at this point is determined on a case by case basis, so they can determine, as far as disability level, but we are getting them through. Basically, you can contact the health insurance with this certain codes, and this is all done before any procedure is performed. So it's no guessing going in. So some information about the second side treatment, some clinical trial information, and some of the results. So who's suitable for the second side to be treated? So essential tremor patients, again, with medically refractory tremor, similar to the first side. Treatment of the contralateral side that wasn't previously treated, we typically stage this at least 9 months after the first side treatment. Again, age needs to be at least 22. And then the area of the brain that's responsible for it, this VIM target that we use for treating tremor, has to be identified and accessible basically by the device itself. So similar criteria to the first side treatment. Some of the clinical trial results from the second side, a little bit better even, about 80% of tremor improvement at a 6-month follow-up. There isn't 5-year data as of yet, but I suspect it will maybe drop off a little bit, but hopefully be at least as good as the first side. About 65% effective immediately for tremor and function, and sustaining through 6 months. It's consistent with treatment of the first side. The disability, about 75% improvement, having had second side done as well. Similar side effects to as the first side, so kind of right afterwards, numbness and tingling. Some slurring of speech may show up with second side treatment, and then also some unsteadiness with walking. Most of these, again, improved with time. Didn't see any device-related adverse events. And there was only one serious event recorded in this trial, which was a UTI from a catheter that was used. Again, not related to the procedure itself. Some infrequent side effects, again, just to report them: weakness, some dizziness, dry mouth, decreased sensation, some double vision, drooling, and voice change. Again, relatively infrequent and improving with time. So what are the patients themselves that were in this trial? So this second side treatment, it had about 50 patients in the trial. Age was about 73 years, plus or minus 10 years. Age range was pretty wide over the people that were treated, mostly men, mostly white men. And most folks, again, kind of noted 36 years from initial essential tremor. So most people have been living with this for quite some time before they'd had treatment. And the averages in staging was about two years from the first side treatment. So there's no urgency to do the second side, but again, at least 9 months later, it can be done. So what are some next steps? Basically speaking with your primary care provider for a referral to neurology or the neurosurgical services for evaluation of tremor that might be treatable by ultrasound, or for potentially deep brain stimulation if that's a consideration as well. If not doing adequate with medications, that'd be an indication for referral. This is our ultrasound coordinator, Catherine Boone. There's her phone number. And I'll leave this slide up as we take some questions.
All right. Thank you so much for your thorough presentation, Dr. Butler. It looks like we do have some questions in the chat already. And for our attendees, please continue to enter your questions with the Q&A button at the bottom of the screen. While we're answering the questions, please feel free to take a picture of this slide with the program coordinator's contact information if you'd like more details or if you'd like to schedule an appointment. All right. So your first question, Dr. Butler, is do you know of anyone doing this procedure here in Virginia?
Well, we do the procedure at Riverside. We have the device at our Newport News hospital, Riverside Regional Hospital. There's also some groups, believe there's one in Norfolk. There's maybe a device in Virginia Beach, I think. And then in Richmond, there's a couple locations that have the device itself.
Got it. And our next question is, does all the hair have to be removed when you're not targeting all areas? You're just aiming for that specific location in the VIM. And what's the rationale of having to shave their head?
Right. Yeah. Unfortunately, yes, they do have to shave all the hair off. The reason for that is that the ultrasound that's being delivered is coming from a cap that surrounds the entire skull. So there's a little bit of energy coming from hundreds of different areas, and all those ultrasounds need to focus down into one specific point. So even though we're targeting one point, all of the energy comes from a whole lot of different ultrasound emitters. So yes, it's at this point, yes, they still have to shave all the head. They're doing some research on how much energy can be delivered without shaving the head, but that's not at this level yet for clinical application.
Got it. And then we have a couple insurance questions. Somebody's asking generally, what's the average cost of the procedure?
So that would be depending on the specific insurance. If there's a copay for the insurance or for hospitalization for the insurance, I think that'd be a very individual answer. But a lot of those questions can be addressed, if it's going to be considered by an individual. Certainly that information is available before going through with it.
Perfect. And we have a question, does Medicare cover the procedure for Parkinson's?
Yes, it's covered by Medicare for Parkinson's with the target for tremor. There's some more strict criteria for one of the other targets, something called a GPI, and we haven't really done very many of those. There's the new target I talked about for Parkinson's disease, something called a PTT, which is the posterior thalamic tract. And that hopefully will address slowness in movements as well as dyskinesia, which are additional symptoms in Parkinson's besides just tremor. That's not really getting insurance coverage as of yet, but it's being worked through. So to come in the future.
Got it. Thank you. And you'd mentioned that Riverside, of course, offers the procedure, and there's a couple other locations in Virginia. Somebody's questioning if the VA is involved at all.
I'm not sure if the VA is involved as far as the procedure itself, but they should be able to provide coverage for it if you meet the criteria. It's like any other thing that gets referred out of the VA.
Got it. All right. We have another question about maybe some comorbidities or something that may preclude the procedure. Somebody's asking specifically about if they've had gamma knife in the past, or if they've had a stroke, or if they have a pacemaker. Would any of those things exclude them from being able to have focused ultrasound?
Right. So if you've had gamma knife for tremor, which was done previously, um, it kind of depends on how much of residual tissue there is in the area that's being targeted. If there's some additional options for treatment, that would be based off of what we see on imaging. If you've had gamma knife for something else, such as a malignancy, then it just depends on the area that's been treated. It's not a contraindication. If you've had a pacemaker, sorry, what was the second part of the question? Gamma knife?
A small stroke.
Small stroke. If you've had a small stroke, no, that's not a contraindication for the procedure. Again, it depends on the area of the brain where it was involved. If that area was involved with the stroke, then putting ultrasound energy onto that location probably wouldn't do a whole lot of benefit. But again, depends on location. As far as a pacemaker is concerned, if the pacemaker is MRI compatible, it can be performed at a location who has cardiology coverage during procedures. So it is still feasible. Riverside is not performing those as of yet, but there are locations in Virginia that do that.
Understood. And we have a bunch of questions about different types of implants. So I don't know if you want to just speak generally about the different types, if that would preclude them from having the procedure.
Oh, pretty much so if you can get an MRI with the implant that you have, then you should be able to undergo a procedure like this. As long as it's an MRI compatible device, then it should be feasibly able to be performed.
Understood. All right. We have some questions about different types of tremor. So if someone has Parkinson's, will this only help their hand tremor, or would it help with small movements and space perception issues as well?
Right. So currently, it depends on the target. The tremor target is that VIM, which is in the thalamus. That's only really targeting rest tremor or action or postural tremor. So tremors when you're trying to do things. If you're having small movements, so bradykinesia or coordination issues, that would be one of the other targets that are approved. So either a GPI target or this PTT target that I was talking about. So that's much newer and still being optimized, but they are potential targets.
And for essential tremor patients, would this help with head tremor in addition to the hands?
Right. So it's not targeted for head tremor. And with one side treated, most likely not. Now, if you treat both sides, and this information kind of comes from treating people with deep brain stimulation with essential tremor. If you treat both sides, a lot of times you will get some improvement in head tremor or midline tremor. Now, it's not targeted for that. So the predictability of how much benefit someone may have is hard to assess. But a lot of times folks will have some midline improvement if both sides are treated.
And kind of piggybacking off of that, what's the specific criteria you use to qualify someone for an intervention for tremor? How severe does it have to be?
Well, the criteria is basically just disabling tremor. So if the tremor is to a degree that is keeping you from being able to do your day-to-day tasks or your what are called activities of daily living, then that can be considered a disabling tremor. If you don't tolerate the medications because of side effects, or you have a contraindication to the medications because of other health issues, that a lot of times can keep people from using the medications, so tremor may be worse off. So someone may be more likely to be a good candidate for procedural treatment in those instances.
Understood. And then if someone has a tremor that starts on one side, but it moves to the other side, and then they also have a core tremor, regarding somebody with Parkinson's, could they be a candidate for focused ultrasound, or is it more just for the hand tremor?
Again, kind of going back to the treating the midline or head tremor, it's the same idea. One side is going to treat one side of the body, and then if the other side is treated, and oftentimes both limbs will be treated, but midline symptoms often will improve as well with both sides treated.
Got it. And circling back to implants, how would somebody know if their implant was MRI conditional?
Typically, people get a card with the device itself, or whoever put in the device, they can usually find the information about it. And then there are databases or banks if the device itself is compatible. Usually, if it were within about the last 10 to 15 years, most of those devices are MRI compatible. If it's older than that, it may not be. May not be.
Thank you. So you talked about essential tremor also being called familial tremor or being hereditary. Somebody is curious if it comes from their mother's genes or where it comes from in their family.
I don't think it's linked one side or the other as far as like a sex-linked gene that's passed down. It's usually if there is someone in the family that has it, either father or mother, it can pass down either way. You can't blame one side more than the other.
And then how many procedures has Riverside performed? How many focused ultrasounds?
So Riverside performed their 100th procedure this last August, and we continue to go fairly strong. There's several every month that are done. Some months are more than others, but yeah, it continues to grow as far as how many folks are being treated.
Great. And it looks like one more for now. Could you expand a little on the deep brain stimulation procedure?
Sure. So deep brain stimulation, it's another procedural treatment for tremor as well as Parkinson's disease and for a condition called dystonia. It's a neurosurgical procedure where a couple of small electrodes about the size of angel hair pasta are implanted down into a deep structure in the brain, hence deep brain stimulation. It's the same location that we use to target with the ultrasound. That electrode is implanted and then it runs out to a wire that runs underneath the scalp, comes down to what looks like a pacemaker that's on the chest wall, which is a battery as well as a computer that allows us to deliver electrical energy to the brain, and it interrupts some of the neurological energy or neurological signaling that's coming from that targeted area of the brain. And by doing that, it helps reduce tremor symptoms, or with Parkinson's disease with specific targets can also address slowness in movements, stiffness, as well as tremor.
And then somebody is curious how long the treatment takes. Could you talk about both DBS and focused ultrasound, please?
Sure. So for focused ultrasound, it takes several hours as far as the treatment is concerned. It's done over typically a morning. You come in, they get everything lined up, as we saw on the slides. You go into the machine. You may go in and out of the MRI machine multiple times just to make sure that tremoring is reducing as we want it to. Side effects aren't happening, and then the treatment is delivered. Typically, people are typically home by the afternoon. Deep brain stimulation is performed as a two-part procedure. The first part is where the electrodes are actually implanted. Most folks spend the night, well, pretty much everybody spends the night in the hospital after that procedure, at least for one night. Most folks go home the next day. We let that heal up for a couple weeks, and then you come back as an outpatient, and the battery and the wire underneath the scalp are put in. That's done under general anesthesia, and then they go home the same day. Heal up for about another 2 to 3 weeks, and then you come back and have the device programmed. So for deep brain stimulation, takes about a month to 6 weeks from kind of initial start until programming. With ultrasound, it's done in one go, and that's it.
Perfect. And we just have one last question for you, Dr. Butler. If someone is new to Riverside, about how long would it take them to schedule an appointment with you?
Sure. So typically we take referrals from people's primary care doctors. If it's for a specific device evaluation or an interventional evaluation, we can usually get people in within a few weeks. Just have the patient or the person wanting the referral to make sure they have their primary doctor put that on there for the referral, so we know to mark it to get them in faster. If it's not marked and it's a routine, it could be anywhere from 2 to 3 months.
Got it. And we did have one more come in. After the procedure, are patients able to stop their medication?
A lot of times for tremor, if it's the dominant side that's treated, yes, they can usually back off on the medications. If there's still fairly severe tremor and the untreated side starts to tremor a lot more, I do have some people that still remain on the medications just to treat the ultrasounded side. So it kind of depends on the individual.
Understood. And you spoke a little bit about the SDR calculation to make sure that someone's eligible for the procedure. If the skull is too thick, is the procedure not completed, or if it's too thin?
If it's it's too dense. It's not too thick. So if the problem is if the energy from the ultrasound can't get through the skull adequately, you can't get the proper heating in the brain. So if you were to try to do it with someone whose skull is too dense, you may get some improvement, but it's not going to be as good of a result, and it may not last. So it's typically not performed. In those instances, I have seen folks go then to deep brain stimulation as a backup. So that's usually our backup plan if the ultrasound's not an option.
Excellent. All right. It looks like there are no further questions at this time. Dr. Butler, thank you again for your time this evening and hosting this educational virtual event. And thank you to all of our attendees for taking the time to join us. If you'd like further information, please contact Riverside's program coordinator, Kat Boone. Have a great evening, everyone.